USMLE Step 2 CK Hematology Part 21. Topics: Classic hemophilia is factor 8 deficiency, also called hemophilia A. This is X-linked recessive disease, so patients are usually male. So X-linked recessive disorder, in this case patient could have family history of, like, maternal uncle had factor 8 deficiency, or some people even can have new mutation. Lack of factor 8 in the boy. This leads to the sign of severe deficiency of the factor, and it can cause the bleeding into the joint, hematorosis, and we'll see the bruising in the joint when patient walk. And if patient have recurrent hematorosis, result in joint injury by iron, hemosiderin, and when iron deposit, and that can cause the thickening of the synovial, and after that also can produce the fibrosis at the joint, and we call it hemophilic arthropathy. And deposit of iron in the joint, which can cause the release of the cytokine from the blood, cause the fibrosis, and this cause the injury to the cartilage, and patient could have synovial proliferation at the joint. Patient may complain of pain at the joint and limited motion of the joint. Patient could have hematoma, muscle subcutaneous tissue, GI bleeding, urinary bleeding, central nervous system bleeding, bruising, epistaxis. And less than 2-year-old boy could have mild deficiency of the factor, and the boy could be normal. When boy have trauma, but before trauma boy was normal. After the trauma, or he was circumcised, or his tooth was extracted, and that can cause child have prolonged or excessive bleeding, and boy have unusually long time bleeding. Or boy is less than 2-year-old boy have severe factor deficiency and could show all the symptoms mentioned above in very early age. Most of the factor 8 deficient patients show hematoma when 1 year old. Physical exam: excessive bruising, fall down could make it even worse. Observe carefully of those organs which bleed severely before. Iron deposition can injure the organ, like say in the joint. So diagnosis: history of bleeding and also family history of bleeding disorder. PTT will be prolonged. We know that factor 2, 5, 7, 10 deficiency increase the PT, and all of this except 7 and 13 increase the PTT. So this guy will have prolonged PTT. If you have prolonged PTT, and you can, for diagnosis, you can give plasma rich with the factor, and after that PTT become normal. Serum test: deficiency of factor 8 but bone wool band is normal. So do the assay. Better to do the assay than give the fresh frozen plasma. And we call the fresh give plasma rich with the factor. Fresh frozen plasma, usually we don't give it, we just only give the factor. Like say factor 8 deficiency, only give the factor 9 deficiency, only give the factor 9. Don't give the fresh frozen plasma. The most specific test to identify the hemophilia A, hemophilia is the assay for factor assay for factor 8 and 9. And the treatment for a mild disease, for example, when a patient will go for surgery or when patient has symptom, give desmopressin for hemophilia A. This is for mild disease. For severe disease, for hemophilia A, give factor 8. For mild and severe disease of hemophilia B, give factor 9. And be careful to give the antiplatelet drugs like aspirin to these people. So all factor produced in the liver except factor 8 produced in the endothelial cell of the blood vessel. It also produces the bone-wheel band fracture. Hemophilia A patient could have bone-wheel band fracture, could be normal and have deficiency of the factor 8. So Christmas disease, we call the factor 9 deficiency, also called hemophilia B. This also X-linked recessive disease like hemophilia A. So male usually have symptom. So lack of factor 9 deficiency, almost everything will be same like factor 8 deficiency. And like bleeding in the joint, patient could have history of the minor trauma which could cause the bleeding at the skeletal muscle and subcutaneous tissue, and result of it patient could have swollen and tender at the muscle. Bleeding could occur in the multiple places and it could be life-threatening. This patient could have bleeding at the head and neck which may lead to the epistaxis. This patient also could lose blood through the GI and genitourinary tract. Hematology. Both factor 8 and 9 can cause the joint bleeding 80% of the time. Bleeding at the other side like GI is not as frequent as the hematology to the patient with clotting factor deficiency. Physical exam, you will see the swollen tissue could press on the blood vessel, and physical exam could find absence of the pulse. So hematoma press the blood vessel and it can decrease the pulse. And diagnosis PTT for long. Normal bleeding time, platelet count and PT thrombin all are normal. Serum platelet equal the assay of factor. If you do, and you will find factor 9 has deficiency. And treat this guy can give vitamin K. Vitamin K need to produce 9, 10, 7 and 2. And due to both disease like hemophilia A and B is indistinguishable clinically Clinical presentation, diagnosis, treatment of hemophilia B discussed with the hemophilia A. Hemophilia A is more common than hemophilia B, so almost all have same symptom, same diagnosis. Only factor SA can differentiate deficiency of the factor 8 or factor 9. Factor 11 deficiency. Most of the time patient does not have any bleeding problem, but the patient could have bleeding problem when patient has trauma such as surgery. This patient has prolonged PTT, normal PT. If this patient serum would mix with normal person serum, result will come normal PTT. So if bleeding is going on, give fresh frozen plasma. So you will do the same thing like assay of the factor, and you will find the deficiency of the 11, and in this case you can give, all other case you can give fresh frozen plasma except the deficiency of the factor 8 and 9. Note, fresh frozen plasma. When PTT, PT, iron, INR increase, give fresh frozen plasma. When patient has bleeding, give fresh frozen plasma, but never give fresh frozen plasma to the patient with hemophilia factor 8 or 9, von Willebrand disease. Only these three cases don't give fresh frozen plasma. Factor 12 deficiency, PTT full on, when patient has factor 12 deficiency, but do not cause the bleeding, so there is no treatment is needed. Probably this go unnoticed. Liver disease. We know all factor produced in the liver. So liver disease, decreased production of the clotting factor except factor 8 and von Willebrand factor. Patient has hemophilia A and B type coagulopathy. Clinical presentation is like hemophilia and vitamin K deficiency. Patient could have severe nasal bleeding. We know that vitamin K need to produce clotting factor at the liver. So liver disease lead to increased pressure at the portal vein and splenic vein. Spleen enlarge, destroy platelet, patient develop thrombocytopenia. Depend on how severe is the liver disease. And in liver disease, PT, PTT and thrombin time will be increased. That's why anytime PT increase, do the liver function test. And give vitamin AK, and you will probably not find any improvement. So rule out vitamin K is not the problem to produce the clotting factor. Perform the venopenza, and you will see the oozing the blood. Treatment. When patient has active bleeding or patient will undergo for the surgery or need invasive procedure, give fresh frozen plasma and vitamin K. If have a liver disease and he need to go for surgery, give this guy fresh frozen plasma and vitamin K. When patient has no active bleeding, give vitamin K only. And vitamin K will increase the production of the clotting factors such as 2, 7, 9 and 10. Note, Liver and the endothelial cell of the blood vessel produce the factor VIII.